Okay, so my speech is over dental hygiene, and as many of you know, my mom works in a dentist's office, so I'm on being told to take care of my teeth, and I'm going to inform you guys about the importance of taking care of your teeth. So, by show of hands, don't lie, how many of you floss like on a daily basis?
Yes.
Alright. Okay, so I'm going to talk to you guys about the cause and effect, different types of problems that occur in the mouth, and how our oral health affects our general health, and I'm going to explain to you guys the steps of a surgery. So, according to Academy of General Dentistry, there's a relationship between gum disease and health complications. So, if you have an infection in your gum, it can travel throughout your bloodstream and affect your body. So, I'll explain more of that later. So, such as stroke, heart attack, dementia, kidney disease, and oral cancer. And the effects of not taking care of your teeth would be pain, infection, tooth loss. Based off studies from the Office of the Surgeon General, oral health is connected to problems in the heart and other major organs, and advanced gum disease affects more than 75% of the U.S. population. And people with tooth loss that don't wear dentures, if they don't wear them when they're eating, they can have trouble swallowing, which can cause digestion problems. And if your body is lacking nutrition, you may have a more difficult time resisting infection. So Oral Health Care Center describes plaque as a sticky film of bacteria that constantly forms on our teeth. And this is made of bacteria, sugar, bits of food, and saliva. And this can lead to gingivitis, which is a gum disease that makes your gums red, swollen, and sore. And plaque occurs when bacteria breaks sugar down into acid and it eats away at your tooth enamel, and that's how cavities are created. So saliva washes away food and balances acid in the mouth, which protects you from diseases. So certain medications can slow down your saliva, which can make you more prone to infection. And periodontitis, and I have a picture of it right here, is a gum infection, and it damages soft tissue and destroys your bones. So you can tell in the picture that the periodontitis, the gums are receding and there's less bone structure on the teeth. Endocarditis is when bacteria, like I said earlier, it's an infection in your gum and it can spread throughout your body, and this attacks damaged areas in your heart. Dental Hygiene Foundation states that a healthy mouth enables not only nutrition of the physical body, but also enhances social interaction and promotes self-esteem and feelings of well-being. And this picture says you don't have to brush your teeth just once you want to eat. Oral disease is the most widespread chronic disease, and some obvious things that affect your oral health is your diet, tobacco, if you smoke, or if you drink alcohol, injuries such as dental trauma, and stress such as periodontal disease. And here's another picture of it. You can tell the healthy side, the gums are more pink and the bone level is high, and the periodontal disease, there's plaque and the bone level's low and the gums are red and infected. And here's another picture just of how your teeth affects the rest of your body, like your gut and your liver and your heart and even fetus. Okay, so I'm going to show you guys some pictures, and these pictures are from, all these images are from Theodore B. Kroll, and he's a pediatric dentist specialist, and he has a private practice in Pennsylvania. So this person has no home care whatsoever, and you can tell there's plaque all over their teeth. They don't floss or take care of their teeth at all. And this is a purple stain, and so you put it on your teeth and it shows like all the bacteria and plaque that's sitting on your teeth. And this is what happens to all you guys who don't floss. Food just sits in between your teeth. And the closer your teeth are together, the harder it is for the toothbrush to get in between those teeth. So that's what happens. When you don't floss, it just sits between your teeth. And then this is the mouth of a 3-year-old that used a nursing bottle filled with juice, flavored sugar drinks, soda, and milk. And so you can tell it affects you at a young age. Okay, so I'm going to explain to you guys the steps of a procedure I had when I was about 12, just because I think it's kind of cool. So there's one picture that's really graphic, but I'll warn you guys before. So it's exposure of an impacted canine. And what that is when a tooth is stuck in your gums, and it can be up here or down there, where number 3 is. And it's when it won't come down, so they have to go in and surgically remove it. So here's an x-ray on my teeth, and you can tell they're clear up here, so they're clear up there in the gums. And the next picture is really graphic because my mom had to get in and take a picture. So that's kind of what they do. And I'll just explain to you guys the steps because the videos are really graphic and gross. So it's pretty simple. They just cut your gums around that tooth and they'll move the flat back and they'll clean it up and they'll put the bracket on your tooth and then they'll connect it down on this wire and then they'll stitch the gum back up and then eventually the tooth will just come down. So I just think it's cool how they can do that. And then that's an x-ray. So I talked to you guys about the cause and effects, how our oral health affects our general health.